Dr. Maya Chen had seen it all in her 15 years as a forensic psychologist, but the woman sitting across from her made something cold crawl up her spine. Rebecca Martinez looked like any suburban mom: blonde highlights, yoga pants, designer purse, yet she was here for allegedly poisoning 3 elderly patients at the nursing home where she worked. Maya opened the file, her hand steadier than her racing heart. This case would either prove Rebecca was a calculating killer or a deeply troubled woman who needed help, not prison. "I don't understand why everyone thinks I'm some kind of monster," Rebecca said, her voice breaking just enough to sound genuine. Tears gathered in her perfectly applied mascara, threatening to spill over. "I love those patients like they were my own grandparents. Mrs. Patterson used to tell me stories about her late husband, Mr. Williams, would light up whenever I brought him his afternoon juice, and Eleanor ... she called me her angel." Rebecca dabbed at her eyes with a tissue, the movement practiced and deliberate. Maya watched every micro-expression, every gesture. This was the part of her job that kept her awake at night, trying to separate genuine emotion from masterful manipulation. Rebecca's tears looked real, but so did those of the most dangerous psychopaths she'd evaluated. The woman's voice carried just the right amount of tremor. Her body language screamed vulnerability. Yet something felt orchestrated about the entire performance. "Tell me about the day Mrs. Patterson died," Maya said, her pen hovering over her notepad. She needed to establish a baseline to understand how Rebecca processed and recalled traumatic events. The answer would reveal whether they were dealing with someone who felt genuine grief or someone who had simply learned to mimic it perfectly. Rebecca's face crumpled. "It was horrible. I found her in the morning when I came to give her medication. She looked so peaceful, but she wasn't breathing. Her voice dropped to a whisper. I performed CPR until the paramedics arrived, but it was too late. I held her hand as they covered her face with that white sheet. I couldn't stop crying for hours." Maya made a note about Rebecca's detailed emotional responses. Psychopaths often struggled with emotional granularity. They could say they felt sad, but couldn't describe the weight in their chest or the way their throat tightened. Rebecca's descriptions were rich, specific, almost too perfect. "How did you sleep that night?" Maya asked, knowing that genuine trauma typically disrupted sleep patterns, while calculated killers often slept peacefully. "I didn't sleep at all," Rebecca replied immediately. "Every time I closed my eyes, I saw her face. I kept thinking about what I could have done differently, whether I missed some sign that she was declining. I made myself sick thinking about it." She wrapped her arms around herself, a classic self-soothing gesture that could be either authentic or performed. Maya studied Rebecca's file again. 3 deaths in 2 months, all elderly patients under Rebecca's care. All initially ruled natural until the toxicology reports came back showing traces of insulin in non-diabetic patients. The evidence was damning, but Maya had learned that evidence only told part of the story. Some of the most evil acts in human history had been committed by people who believed they were doing good. while others had been carried out by individuals whose mental illness had disconnected them from reality. "Rebecca, I need you to help me understand something," Maya said, leaning forward slightly. "The families of these patients are struggling to make sense of what happened. They trusted you with their loved ones. If you were in their position, how would you be feeling right now?" Rebecca's eyes widened, and for a moment, Maya saw something flicker across her face. Was it genuine empathy or calculated consideration? "I would be devastated," Rebecca said softly. "I would want answers. I would want justice for the people I loved." She paused, her voice growing stronger. "Which is exactly why I agreed to these sessions. I want you to prove that I would never hurt anyone intentionally." The word intentionally hung in the air like smoke. Maya felt her pulse quicken. It was a curious choice of words for someone claiming complete innocence. Either Rebecca was unconsciously revealing something significant, or she was more clever than anyone had given her credit for. Maya glanced at the clock. They had 43 minutes left in the session, and she was already questioning everything she thought she knew about distinguishing between evil and mental illness. Maya spent the night reviewing every case study she could find about healthcare serial killers. The psychological profiles varied wildly. Some were driven by a God complex, others by a twisted sense of mercy, and a few by the simple thrill of having power over life and death. When Rebecca arrived for their second session, Maya was ready with a different approach. Today, she would explore the woman's relationship with suffering and her role as a caregiver. "I've been thinking about our conversation yesterday," Maya began, watching Rebecca settle into the chair across from her. Today, Rebecca wore scrubs, her work uniform, which Maya noted could be either a subconscious attempt to remind everyone of her caring profession or a calculated move to appear more sympathetic. "You mentioned feeling like an angel to Eleanor. Tell me more about that relationship." Rebecca's face softened genuinely for the first time since Maya had met her. Eleanor had dementia. Most days, she didn't recognize her own children when they visited, but she always knew me. She'd grab my hand and tell me I was sent from heaven to watch over her. Rebecca's voice grew wistful. She was in so much pain toward the end. The cancer had spread everywhere, and the morphine wasn't helping anymore. She'd beg me to make it stop. Maya made careful notes about Rebecca's tone and body language. This was the first time she'd mentioned a patient's pain in detail, and her demeanor had shifted from defensive to almost reverent. "How did that make you feel, hearing her beg?" "Heartbroken," Rebecca replied immediately. No one should have to suffer like that. Her family kept insisting the doctors do everything possible to keep her alive, but they weren't the ones holding her hand at 3 in the morning when she was screaming from the pain. They weren't there when she begged God to just let her die with dignity. Maya felt a chill run through her. Rebecca's passion was undeniable, but passion could fuel both compassion and cruelty. "Did you ever feel tempted to help her find peace?" Rebecca was quiet for a long moment, her fingers twisting in her lap. "I used to pray about it," she admitted. "I'd ask God to show me what He wanted me to do." I couldn't understand why he would allow someone so sweet to suffer so much when I had the knowledge and access to help her. The confession hung between them like a loaded gun. Maya had interviewed enough killers to recognize the moment when someone revealed their true motivation. But Rebecca's voice carried genuine anguish, not the cold calculation of a predator. This was either the most convincing performance Maya had ever witnessed, or they were dealing with someone whose mental illness had convinced her that murder was mercy. Knowledge and access, Maya repeated carefully. What do you mean by that? Rebecca looked up, and Maya saw something desperate in her eyes. I'm a certified nursing assistant. I know what medications do, how much is therapeutic, and how much is more than therapeutic, and I had access to the medication room. The other nurses trusted me completely. She paused. Sometimes I think that trust was more of a burden than a blessing. Maya's pen moved steadily across her notepad. Rebecca was walking the line between confession and justification, painting herself as someone burdened by knowledge rather than someone who had abused it. The psychology was fascinating and terrifying. If Rebecca genuinely believed she was ending suffering rather than taking lives, it would explain how she could sleep at night after killing 3 people. Did you ever discuss these feelings with anyone? A supervisor, a chaplain, a friend? I tried talking to my supervisor once about how hard it was to watch patients suffer, Rebecca said. She told me that death was a natural process and that it wasn't our place to interfere with God's plan. But what if God's plan was for me to be there? What if He gave me the knowledge and opportunity because He wanted me to help them? The religious justification was classic for what psychologists called angel of mercy killers, healthcare workers who murdered patients under the guise of ending suffering. But Maya had to determine whether Rebecca was a cold-blooded killer using religion as cover or a genuinely mentally ill woman whose distorted thinking had led her to commit unthinkable acts. Rebecca, when you gave Mrs. Patterson her final dose of medication, what were you thinking in that moment? Rebecca closed her eyes, and when she opened them, they were filled with tears. I was thinking that she was finally going to be free from pain, that her husband was probably waiting for her on the other side, that maybe for the first time in months she'd be able to rest peacefully. Her voice dropped to a whisper. I held her hand and told her it was okay to let go. Maya felt her stomach twist. The image Rebecca painted was almost tender, a caregiver easing someone's transition from life to death. But beneath the compassionate veneer was the cold reality of premeditated murder. The question that would determine Rebecca's fate was whether her actions stemmed from a mental illness that distorted her perception of reality or from a calculated decision to play God with other people's lives. How did you decide on the dosage? Maya asked, her voice steady despite the gravity of the question. Rebecca's hands began to shake. I researched it. Online medical journals, nursing forums, textbooks from my certification courses. I wanted to make sure it would be peaceful, that there wouldn't be any pain or struggle. She looked directly at Maya. If I was going to help them, I wanted to do it right. The clinical preparation, combined with genuine emotional distress, created a complex psychological portrait. Maya realized she wasn't just evaluating whether Rebecca was evil or mentally ill. She was trying to understand how someone could methodically plan murder while genuinely believing it was an act of love. Could you have spotted Rebecca's warning signs before it was too late? By the third session, Maya had consulted with 3 colleagues and spent hours studying the intersection of mental illness and criminal behavior. Rebecca arrived early, sitting in the waiting room with a book about hospice care, a detail that either demonstrated her genuine interest in end-of-life issues or her continued manipulation of perception. Maya decided it was time to probe deeper into Rebecca's sense of authority and decision-making. "I've been thinking about what you said regarding having knowledge and access," Maya began as Rebecca settled into her usual chair. "You mentioned researching proper dosages. That suggests you saw yourself as qualified to make life and death decisions. Help me understand how you came to that conclusion." Rebecca straightened in her chair, and Maya noticed a subtle shift in her demeanor. Less victim, more professional. "I had more experience with dying patients than most of the nurses I worked with. I'd been there for over 5 years, and I'd seen hundreds of people pass away. The doctors would come in for 5 minutes, make notes and charts, and leave. The nurses were overworked and couldn't spend quality time with each patient. But I was there during the long nights, holding their hands, listening to their fears." Maya made a note about Rebecca's growing confidence as she discussed her role. "So you felt more qualified than the medical professionals to determine what was best for your patients?" "I wouldn't say more qualified," Rebecca replied carefully, "but more connected. I knew these people as individuals, not just medical cases. I knew Mrs. Patterson's favorite hymn and how she worried about her cat. I knew Mr. Williams had been a war veteran who was terrified of dying alone. I knew Eleanor's biggest fear was becoming a burden on her children." Rebecca's voice grew passionate. "The doctors saw symptoms and vital signs. I saw human beings who were ready to go home." The language Rebecca used was telling, going home instead of dying, positioning herself as someone who understood her patients' true needs better than their families or doctors. Maya recognized the classic signs of a God complex, but she also heard genuine emotional connection in Rebecca's voice. The combination was deeply disturbing. "When you say they were ready to go home, how did you determine that?" Rebecca was quiet for a moment, her eyes distant. "They would tell me. Not always in words, but in the way they looked at me when the pain got bad. Mrs. Patterson grabbed my hand one night during a particularly difficult episode and whispered, 'Please, Rebecca, I can't do this anymore.' Mr. Williams stopped eating and would just stare at the ceiling, tears running down his face. Eleanor started asking me when Jesus was going to come for her." Maya felt the hair on her arms stand up. Rebecca was describing classic signs that terminally ill patients often displayed, verbal and nonverbal cues indicating readiness to die. But the leap from recognizing these signs to taking action was enormous. How did you interpret those moments? "As permission," Rebecca said simply. They couldn't ask outright because of their families, the legal implications, the stigma. But they trusted me to understand what they really needed. She leaned forward slightly. Do you know how many times I watched patients suffer for weeks or months because their families couldn't let go? I saw the relief in their eyes when they finally passed naturally. I just shortened the suffering period. Maya's pen had stopped moving. Rebecca had just admitted to murder while framing it as a mercy killing, but her tone suggested she genuinely believed she'd been providing a service. The psychological profile was becoming clearer. Rebecca suffered from a complex combination of savior complex, boundary issues, and possibly delusional thinking that had convinced her she was qualified to end human suffering. Did you ever consider that you might be misinterpreting their signals? That maybe they were looking to you for comfort, not for someone to end their lives? Rebecca's face hardened slightly. I wasn't some naive girl playing nurse. I had training, experience, and most importantly, I had relationships with these patients. I could tell the difference between someone having a bad day and someone who was truly ready to let go. She paused. The families thanked me after each death for being such a comfort to their loved ones. They had no idea how much comfort I'd actually provided. The last sentence sent a chill through Maya. Rebecca wasn't just admitting to murder. She was proud of it. But the pride seemed rooted in genuine belief that she'd help people, not in the satisfaction of causing harm. This distinction was crucial for determining whether Rebecca was a psychopath who enjoyed killing or a delusional woman whose mental illness had led her to commit horrible acts while believing she was helping. Rebecca, walk me through your thought process the night you decided to help Eleanor. Take me through every step, every feeling, every decision. Rebecca closed her eyes, and when she spoke, her voice took on an almost meditative quality. It was a Tuesday night. Eleanor had been crying for 3 hours straight. Nothing the nurses tried could calm her. Her daughter had visited that afternoon and told her she needed to fight harder, that giving up wasn't an option. But I could see in Eleanor's eyes that she didn't want to fight anymore. She was exhausted. Maya leaned forward slightly. What happened next? I stayed with her after my shift ended. I held her hand and sang hymns until she fell asleep, but I knew she'd wake up in pain again in a few hours. That's when I went to the medication room. I remember standing there for probably 10 minutes, just staring at the insulin vials. I kept thinking about Eleanor's granddaughter's wedding next month and how Eleanor had been so worried about missing it. But she was never going to make it to that wedding anyway. She was just going to suffer for 3 more weeks and then die right before the ceremony. Rebecca opened her eyes and looked directly at Maya. So I decided to give her the gift of dying peacefully that night instead of in agony 3 weeks later. I calculated the dose carefully, drew it up into a syringe, and went back to her room. She was awake, staring at the ceiling. When she saw me, she smiled and said, "Are you my angel?" I told her yes, and I gave her the injection through her foreport. She was gone in 15 minutes, no pain, no struggle. Just peace. Maya felt sick. Rebecca had just described premeditated murder with the tenderness of someone discussing a beloved pet's euthanasia. The clinical detachment combined with emotional investment created a psychological profile unlike anything Maya had encountered in her career. Maya had barely slept since Rebecca's detailed confession about Eleanor's death. She'd spent the night researching precedent cases and consulting with forensic psychiatrists across the country. When Rebecca arrived for their fourth session, Maya was prepared to explore the woman's capacity for rationalization and her ability to distinguish between right and wrong, key factors in determining legal sanity. "I want to talk about consequences today," Maya said, watching Rebecca's face carefully. "Not just legal consequences, but the ripple effects of your decisions. Let's start with Eleanor's family. How do you think they would feel if they knew the truth about how she died?" Rebecca shifted in her chair, the first sign of discomfort Maya had seen from her. "They would be upset initially," she admitted. "People have been conditioned to see death as something to fight against at all costs. But if they could step back from their grief and really think about Eleanor's quality of life in those final weeks, I think they'd understand that I gave her a gift." Maya made a note about Rebecca's use of the word conditioned, suggesting she saw herself as enlightened compared to others. "You mentioned Eleanor's granddaughter's wedding. Don't you think the family deserved the chance to say goodbye properly? To have those final weeks together, difficult as they might have been?" "Those weeks would have been torture," Rebecca replied firmly. "Eleanor would have been in and out of consciousness, pumped full of morphine, not really present for any meaningful goodbyes. I've seen it hundreds of times. Families holding vigil around someone who's already gone in every way that matters. Just waiting for the body to catch up." Her voice grew softer. "The Eleanor they loved was already gone. I just helped her body follow her spirit." The philosophical framework Rebecca had constructed around her actions was sophisticated and internally consistent. Maya recognized this as either brilliant manipulation or genuine delusion. "What about the other patients you helped? Did they all fit this same pattern?" Rebecca nodded eagerly. "Mrs. Patterson had Alzheimer's and hadn't recognized her children in over a year. She spent her days confused and frightened, calling out for her deceased mother. The nursing home staff kept her sedated most of the time because she would try to escape, thinking she was being held prisoner. Is that really living, Dr. Chen?" Maya felt the pull of Rebecca's logic, which made her deeply uncomfortable. There was enough truth in what Rebecca was saying to make her arguments seductive, but the conclusions she'd drawn were terrifying. "And Mr. Williams?" "Stage 4 pancreatic cancer, 2 weeks to live at most. He was a proud man who had served his country, and the cancer had reduced him to someone who couldn't feed himself or control his bodily functions. He told me he'd rather die in battle than waste away in a hospital bed. I gave him the warrior's death he deserved." Maya realized that Rebecca had constructed elaborate narratives around each murder that cast her as a compassionate hero rather than a killer. The level of self-deception required to maintain these beliefs suggested significant mental illness. But Maya had to determine whether Rebecca truly believed her own stories or was simply an expert manipulator. "Rebecca, I need you to consider another perspective," Maya said carefully. What if you were wrong about what these patients wanted? What if Mrs. Patterson had moments of clarity you didn't witness? What if Mr. Williams was finding meaning in his final days that you couldn't see? What if Eleanor was holding on to spend one more day with her granddaughter? Rebecca's jaw tightened. I was with them more than anyone else. Their families visited for an hour or two, then went home to their comfortable lives while these people suffered alone. The doctors made their rounds and moved on to the next patient. The nurses did their job and went home. But I was there in the dark hours when they cried, when they begged for relief, when they looked at me with such desperate hope that someone would finally listen to what they really needed. Maya noticed Rebecca's voice had risen and her hands were clenched. For the first time, she was showing anger rather than sadness or compassion. You sound frustrated with the families and medical staff. Of course I was frustrated. Rebecca snapped, then immediately seemed to catch herself. Sorry, I didn't mean to raise my voice, it was so hard to watch people I cared about suffer when I knew I could help them. But everyone else was so focused on keeping them alive at any cost that they couldn't see how selfish that was. Maya made extensive notes about Rebecca's anger toward others for not sharing her perspective. This suggested a level of arrogance and judgment that complicated the mental illness defense. Did you ever consider that maybe the families and medical professionals had valid reasons for their approaches? That maybe there were factors you weren't considering? Rebecca shook her head. I considered everything. I researched each patient's condition extensively. I talked to them more than anyone else did. I was the only one who truly listened to what they wanted. She paused. The medical establishment is so focused on prolonging life that they've lost sight of what makes life worth living. I never lost sight of that. Maya felt a chill at Rebecca's unwavering certainty in her own judgment. Whether driven by mental illness or malignant narcissism, Rebecca had appointed herself judge and jury over who deserved to live and die. The scariest part was how reasonable she made it sound. How many other patients did you consider helping but ultimately decided not to? Rebecca was quiet for a long moment, maybe a dozen over the years. But their situations were different. They had good days mixed in with the bad, or their families were actually supportive of palliative care, or they seemed to be finding peace with their circumstances. I only helped the ones who were truly suffering with no hope of improvement. The admission that Rebecca had evaluated and rejected other potential victims demonstrated premeditation and judgment that argued against an insanity defense. But Maya wasn't sure if Rebecca understood the implications of what she was revealing. Could you have spotted Rebecca's warning signs before it was too late? Maya had requested this fifth session to be recorded with video equipment, knowing that Rebecca's nonverbal communication would be crucial for her final evaluation. Rebecca seemed more nervous than usual, perhaps sensing that their conversations were building toward some kind of conclusion. Maya had spent the weekend reviewing every note, every recording, every subtle detail from their previous sessions. Today, she would push Rebecca to confront the reality of her actions. I want to try something different today, Maya began, adjusting the camera angle slightly. I'm going to describe 3 scenarios, and I want you to tell me how you would handle each one. The first scenario: you're walking past a lake and you see a child drowning. No one else is around. What do you do? Rebecca looked confused by the change in approach, but answered immediately. I'd jump in and try to save them, obviously. Or throw them something to grab onto if I wasn't a strong enough swimmer. I'd call 911. I'd do whatever I could to help. Maya made a note. Second scenario: you see an elderly man being mugged in an alley. The attacker is bigger than you, and you're alone. What do you do? I'd call the police immediately and make noise to try to scare off the attacker. Maybe throw something to distract them. I wouldn't directly confront someone dangerous, but I'd do whatever I could to help without getting myself killed. Final scenario: you're at work and a patient tells you they're in unbearable pain and begs you to end their suffering. Their family is insisting on aggressive treatment, and the doctors are following a treatment plan designed to extend life. What do you do? Rebecca's demeanor changed completely. Her shoulders straightened. Her voice became more confident. I listen to what the patient really needs, not what everyone else thinks they need. If someone is truly suffering with no hope of recovery, and they've made it clear they want peace, then helping them find that peace is the most compassionate thing I can do. Maya felt her heart rate increase. Rebecca had just revealed that she saw murder as equivalent to rescuing someone from drowning or helping a mugging victim. In her mind, all three scenarios involved helping someone in distress. Do you see any difference between those three situations? They're all about recognizing when someone needs help and having the courage to provide it, Rebecca replied without hesitation. Too many people see someone suffering and look the other way because intervening is uncomfortable or complicated. I never looked the other way. Maya leaned forward. Rebecca, in the first two scenarios, you would be preserving life. In the third, you would be ending it. How do you reconcile that difference? Rebecca's eyes flashed with something Maya couldn't quite identify: frustration, perhaps, or disappointment that Maya wasn't understanding. Sometimes saving someone means preserving their life. Sometimes it means ending their suffering. The goal is the same: preventing harm and providing relief. The method just depends on the circumstances. Maya realized she was witnessing the core delusion that had enabled Rebecca to commit murder while maintaining her self-image as a helper. Rebecca genuinely could not see the moral distinction between saving a life and taking one. What if you were wrong, though? What if the child wasn't actually drowning, but just playing? What if the elderly man was just talking to someone he knew? What if the patient was having a bad day, but might have had good days ahead? I wouldn't act unless I was certain, Rebecca replied. I'm trained to assess situations quickly and accurately. I spent years learning to read people's needs and respond appropriately. She paused. And I was never wrong about my patients. Each one thanked me in their final moments, either with words or with the relief I could see in their eyes. Maya felt sick. Rebecca was describing the gratitude of dying people as validation for murder, further reinforcing her delusion. Rebecca, What if I told you that Mrs. Patterson's daughter had been planning to take her home for hospice care the following week? That the family had finally accepted her condition and wanted to focus on comfort rather than treatment? Rebecca's face went pale. That's not possible. The daughter was still talking about experimental treatments just days before. She wasn't ready to let go. What if Mr. Williams had asked the chaplain to help him write letters to his grandchildren he'd never met? What if he was finding meaning in his final days through those connections? Rebecca began shaking her head. No, he was ready. He told me he was ready. He said he was tired of fighting. Maya delivered the final blow. What if Eleanor's granddaughter had been planning to move up her wedding so Eleanor could attend? What if the family was working with the hospital to bring the ceremony to Eleanor's bedside? Rebecca stood up abruptly, her chair scraping against the floor. You're lying. You're trying to manipulate me into feeling guilty for showing compassion. These people were suffering, and I helped them. I gave them peace. I gave them dignity. Her voice rose to nearly a shout. I was the only one who really cared about what they needed. Maya watched Rebecca's composure completely shatter for the first time. The carefully constructed narrative was cracking, revealing the desperate need for validation underneath. Rebecca, sit down. I'm not trying to hurt you. I'm trying to help you understand the difference between what you believed was happening and what was actually happening. Rebecca remained standing, her hands trembling. You don't understand. You weren't there. You didn't see their suffering. You didn't hear them beg for relief. I was the only one who listened. I was the only one who cared enough to help. Maya realized that Rebecca's entire sense of self-worth was built around being the person who cared more than anyone else, who was willing to do what others wouldn't. Challenging that belief system threatened her fundamental identity. Whether this was mental illness or manipulative self-preservation, Maya now knew she had enough information to make her evaluation. Maya had spent 3 sleepless nights writing and rewriting her psychological evaluation of Rebecca Martinez. The case had consumed her thoughts, appearing in her dreams as a constant reminder of how thin the line could be between healing and harming. As she prepared for what would likely be their final session, Maya knew that her conclusions would determine whether Rebecca spent her life in a psychiatric facility or on death row. Rebecca arrived with dark circles under her eyes, her usual polished appearance replaced by the haggard look of someone who had been forced to confront uncomfortable truths. She moved slowly, as if carrying an invisible weight, and avoided making eye contact with Maya for the first time since their sessions began. "How are you feeling today, Rebecca?" Maya asked gently, noting the dramatic change in the woman's demeanor. "I've been thinking about what you said," Rebecca replied, her voice barely above a whisper. "About Mrs. Patterson's daughter planning hospice care. About Mr. Williams writing letters. About Eleanor's granddaughter." She finally looked up, and Maya saw something broken in her eyes. What if I was wrong? What if I took away their last chances for something beautiful? Maya felt a complex mix of professional satisfaction and human sadness. Rebecca was finally questioning her actions, but the cost was the complete destruction of her self-concept as a compassionate caregiver. It's important that you're considering other possibilities. That shows growth and self-reflection. But I was so certain, Rebecca continued, tears beginning to fall. I watched them suffer every single day. I held their hands when they cried. I listened to them when no one else would. How could I have misunderstood so completely? She wrapped her arms around herself in a protective gesture. If I was wrong about them, then I'm not the person I thought I was. I'm not a helper. I'm not an angel of mercy. I'm just ... Just what, Rebecca? A killer. The word fell from her lips like a stone into still water, creating ripples of recognition across her face. Oh God, I'm a killer. I murdered 3 people who trusted me. I took away their last moments with their families. I stole their final chances for peace, for closure, for love. Her breathing became rapid and shallow. How did I convince myself that murder was mercy? How did I live with myself? Maya watched Rebecca's psychological defenses crumble in real time. This was either the most convincing performance she'd ever witnessed or genuine psychological breakthrough following a psychotic break. The timing was crucial. Was Rebecca having this realization because Maya had challenged her delusions, or because she sensed that maintaining the delusion was no longer serving her purposes? Rebecca, I need to ask you something very important. When you gave those patients their final injections, did you believe you were helping them, or did you know you were killing them? Rebecca was quiet for a long time, her body shaking with silent sobs. When she finally spoke, her voice was hollow. Both. I knew I was ending their lives, but I believed I was ending their suffering. I told myself that was the same thing, but it wasn't, was it? Ending someone's life is ending everything, their pain, but also their hope, their possibilities, their connections. I decided their suffering was more important than everything else they might have experienced. Maya wrote furiously, documenting what appeared to be Rebecca's first genuine acceptance of responsibility. What made you believe you had the right to make that decision for them? I don't know, Rebecca whispered. I think I was so overwhelmed by their pain that I needed to make it stop, not just for them, but for me. I couldn't bear watching people I cared about suffer, so I told myself I was saving them when really I was saving myself from having to witness their pain. She looked up at Maya with devastating clarity. That's selfish, isn't it? I wasn't being compassionate. I was being cowardly. Maya felt her professional detachment wavering. Rebecca's insight into her own motivations was either remarkable, psychological growth, or a sophisticated attempt to appear reformed. How do you feel about that realization? Terrified, Rebecca replied immediately. If I was capable of convincing myself that murder was mercy, what else might I be capable of rationalizing? How can I trust my own judgment about anything? How can anyone else trust me? She paused. I've spent my entire adult life believing I was a good person who helped others. Now I don't know who I am. Maya, recognized the identity crisis that often accompanied major psychological breakthroughs, but she also knew that psychopaths could mimic emotional insights when it served their purposes. The key was determining whether Rebecca's apparent remorse was genuine or performed. What would you want to say to the families of Mrs. Patterson, Mr. Williams, and Eleanor? Rebecca's face crumpled completely. I'm sorry. I'm so incredibly sorry. I stole their final moments with people they loved. I robbed them of the chance to say goodbye properly. I made a decision that wasn't mine to make based on my own inability to cope with suffering. She wiped her nose with her sleeve, her composure completely gone. I would understand if they hated me. I would understand if they wanted me to suffer the way I made their loved ones' families suffer. I deserve whatever happens to me. Maya made her final notes, her evaluation nearly complete. Rebecca was either experiencing genuine remorse and psychological insight, or she was the most sophisticated manipulator Maya had ever encountered. The distinction would determine not just Rebecca's fate, but Maya's confidence in her ability to distinguish between evil and mental illness. As she looked at the broken woman across from her, Maya realized that sometimes the answer wasn't either, or sometimes it was both. Could you have spotted Rebecca's warning signs before it was too late? Maya sat alone in her office at midnight, staring at the completed psychological evaluation that would determine Rebecca Martinez's fate. Outside, rain pelted against the windows, creating patterns that reminded her of tears. After 6 intensive sessions and countless hours of analysis, she had reached her conclusion. But the weight of that decision felt heavier than any case in her 15-year career. The document before her represented more than just a clinical assessment. It was the culmination of humanity's ongoing struggle to understand the difference between evil and mental illness, between calculated cruelty and tragic delusion. Maya had seen both during her career, but Rebecca Martinez existed in the gray area between the two, challenging everything Maya thought she knew about criminal psychology. Her final diagnosis was complex but definitive. Rebecca suffered from a combination of delusional disorder, savior complex, and narcissistic personality traits that had created a perfect storm of distorted thinking. She genuinely believed she was helping her victims, but that belief was rooted in mental illness, not malicious intent. However, Maya had also concluded that Rebecca retained enough contact with reality to understand that her actions were illegal, which complicated the insanity defense. Maya's phone buzzed with a text from the district attorney. Need your evaluation by 9 May. Jury selection starts Monday. She looked at the clock. 12:47 in less than 8 hours. Her professional opinion would set in motion a legal process that would determine whether Rebecca spent her life in a maximum security psychiatric facility or faced the death penalty. The irony wasn't lost on Maya. Just as Rebecca had appointed herself the arbiter of who deserved to live or die, Maya was now tasked with determining Rebecca's fate. The difference was that Maya's decision was based on scientific methodology, legal precedent, and professional ethics rather than personal delusion. But the weight of playing God, even within the boundaries of her profession, felt crushing. Maya returned to her evaluation one final time. Reading through her conclusion, the defendant, Rebecca Martinez, presents with delusional disorder with grandiose features, specifically a savior complex that convinced her she was uniquely qualified to determine when terminally ill patients should die. While she understood that her actions constituted murder in the legal sense, her mental illness distorted her perception of the moral implications, leading her to believe she was performing acts of mercy rather than committing crimes. She paused at the next paragraph, the one that would likely determine Rebecca's fate. However, the defendant demonstrated clear premeditation, rational planning, and the ability to distinguish between legal and illegal behavior. She researched dosages, selected specific victims based on criteria she developed, and concealed her actions from colleagues and families. These factors indicate that while her motivations were influenced by mental illness, her capacity for rational thought remained intact enough to hold her legally responsible for her actions. Maya signed her name at the bottom of the report, knowing she had just condemned Rebecca Martinez to life in prison or possibly death row. But she also knew she had done her job with integrity, following the evidence rather than her emotions. The distinction between evil and mental illness wasn't always clear, but in Rebecca's case, the answer was both: a mentally ill woman who had committed evil acts while retaining enough rational capacity to be held accountable. As Maya finally prepared to leave her office, she reflected on the broader implications of the case. Rebecca's story would likely become a textbook example of how mental illness could distort moral reasoning while leaving rational faculties largely intact. It would spark debates about healthcare oversight, the treatment of terminally ill patients, and the fine line between mercy and murder. But most importantly, it would serve as a warning. Evil didn't always announce itself with obvious malice. Sometimes it wore the face of compassion, spoke in soothing tones, and genuinely believed it was helping. The most dangerous people weren't always those who reveled in causing pain. Sometimes they were those who caused pain while convinced they were preventing it. Maya turned off her office lights and walked into the rainy night, carrying with her the knowledge that she had just defined the difference between evil and mental illness for a jury who would decide Rebecca Martinez's fate. In her final report, she had written the truth as she understood it. Rebecca was neither purely evil nor purely mentally ill. She was a deeply troubled woman whose illness had enabled her to commit unthinkable acts while maintaining her self-image as a healer. The case would haunt Maya for years to come, not because she doubted her conclusions, but because it had shown her how easily good intentions could be twisted into horrific actions when filtered through a diseased mind. It was a reminder that the line between helping and harming was sometimes thinner than anyone wanted to admit. Have you ever met someone whose help felt more harmful than healing? If this psychological breakdown left you questioning everything you thought you knew about good and evil, smash that subscribe button, because we're diving deep into the darkest corners of human psychology every week.